Hello. Hey, this is Dr. Scot Hutchison here from Reproductive Health Center in Tucson, Arizona. And with me is Karina Bakame, who is one of our co-workers who is here to help me go over, best practice for supplements when you're trying to get pregnant and nutrition stuff too. So Karina started out her career as a pharmacy technician in a compounding pharmacy that also did a lot of the dispensing of fertility medication for our patients. And so we got to know her doing that because she put together a lot of those packages for our fertility patients, and she did a great job with it. And so we were then lucky enough to be able to get her from them. And so the last couple of years, she's been working here at Reproductive Health Center. So so Karina does a fair amount of patient education, but she also works in the back office, and because she's bilingual and speaks Spanish as a native speaker, she also fields a whole lot of phone calls from patients. And so I thought her input would be really helpful for us today, because she hears a lot of the complaints that I think a lot of people aren't going to want to tell me, in part, because I'm a doctor and, I'm an old white guy. So anyway, so with that, we try to tell people about supplements. Do you hear complaints about the supplements, like pill sizes or?
I do. A lot of people don't like taking them, which makes sense. I don't like taking pills, but I mean, if you need them.
Yeah, and you really do. One of the important things is folic acid or folate. And this whole thing about whether you should take methylfolate or folic acid is, there's really not enough research right now to recommend, really one or the other, or to even test people for what's called the methylene tetrahydrofolate reductase deficiency. So the only way you can get enough folic acid or folate in your diet to prevent all the birth control or all the birth defects like spina bifida that you can prevent is to either eat tons of processed supplemented flour, like in Captain Crunch or something, by a lot, or to take it in pill form. And, and we don't want people eating a lot of processed flour because it really may be bad. It appears to be pretty bad for you. So taking the folic acid pills really is the way to go. So luckily they're pretty small. The prenatals, are pretty large. Do you hear people complaining about the prenatals?
Oh, yeah.
Just like that they get stuck.
I even complain about them because I take them.
Yeah. So the main thing I think is be honest with us when you're in the office. Like, you don't want to tell me, at least, tell Karina or tell one of our other coworkers, hey, I have a real problem with these pills, because there's other solutions for that. There are chewable prenatals. They kind of taste chalky, but they're pretty decent. So that's a way around it. People can also take the little folic acid pills and just crush them up and then, make them a slurry in water or whatever and take them. But you got to let us know. So not taking the pills is really a bummer. And people who have pill phobias, a lot of time are really embarrassed about it. And I remember a few years ago, we had a patient who was really pill phobic, and she'd had a couple of babies without any trouble. And so she figured she could get away with it. And unfortunately, then she had a baby with a really, really bad spina bifida. And so anyway, just kind of, keep that in mind. Just kind of be honest with us. And especially I've gotten to the point where I tend to ask about it more, but even I'll forget sometimes. So be sure that you tell one of us about it. What other things do people not like?
I think the main complaint is metformin. And metformin, a lot of the patients don't tell you.
Yeah.
They definitely tell us, but they don't tell you.
Right. So, and if you want to, you can always go back to some of our other Hutchison's Huddles here with some of our other colleagues and coworkers to review like polycystic ovary syndrome in more depth. But we still use metformin a fair amount. It's another large tablet because we're using the extended release form. And metformin, I really have gotten to the point where I just feel like it's just to punish you if you eat sugar.
Yeah, it definitely is. A lot of patients call us and tell us that. I'm like, that's kind of what it's supposed to do.
Yeah.
So stop eating bad food, start eating healthy food, and I promise you will not feel bad. But
It will be better.
Yeah.
It's a lot of us, humans, we have a lot of substance abuse issues, and it doesn't matter whether it's, sugar is like a drug. You can put people in a PET scanner, give them a bunch of sugar, and their brain will light up like you just gave them cocaine. So, we get it. Like, tell about it. So we have a patient who's a physician, and what did she say when we told her that you have to drop your sugar content?
Yeah, so Dr. Hutchison was saying, oh yeah, you need to cut the sugar. And she was like, oh no, you can't do that to me. No sugar is like, you're killing me. Yeah. I was like, wow.
You can't do that to me.
You can't do that to me. I was like, oh girl, you don't know what you're doing to yourself.
Yeah. It's kind of, yeah, but I have, I've had relatives who will say things like, don't take away my Dove bars, or my orange juice, so you can tell they're really invested in those things. But yeah, the problem with polycystic ovary syndrome is if we look at it like it's sort of a pre-diabetes, then eating a whole bunch of sugar is really not good for you. And, taking you out to the woodshed and spanking you a little bit if you do eat the sugar is kind of helpful for at least trying to, have a baby. And then we stop the metformin now when people get pregnant, or at least, after the first trimester. I'm still partial to using it through the first trimester, but there's that kind of relationship between childhood obesity and metformin. But, hey, look, polycystic ovary syndrome patients, the majority of them have difficulty with increased body mass and increased risk of type 2 diabetes as it is. What I think it's 50% of them will eventually transition to type 2 diabetes if they don't watch it. So that's not hard to imagine that kids wouldn't be exposed to that higher risk, even without the metformin. But anyway, it's helpful for getting you to ovulate and getting you to get pregnant. Any complaints about vitamin D? Anybody complain about little capsules or anything like that stuff?
I don't think so. No, not vitamin D. I mean, everybody's pretty good at taking those.
Okay, so I recommend 2,000 of vitamin D a day, unless you've been tested, and then if your deficiency is super, super bad, then take more. A lot of the prenatals now have, the minimum on a prenatal is 800 IU. A lot of the prenatals now have even more. So like there's one that's from Theralogics that has 2,000 in it just to begin with. So you do have to kind of be careful and know what your dose is. Unless you're being tested, I don't think I'd probably go beyond 2,000. But I think that's very safe. That prenatal and the 2,000 of vitamin D3 is what I recommend, because I haven't had anybody get toxic on that. If you take a ton of vitamin D and you push your levels like up into the 60, 80 plus, potentially you could get kidney stones. I think that's the biggest worry with that. But I think, that a couple thousand plus whatever's in your prenatal is pretty good on the vitamin D front. Anybody complain about CoQ10?
No.
Okay, so I'm pretty much having everybody take CoQ10. So, and you need it in a medium chain triglyceride source, or it doesn't get absorbed very well. So we tend to recommend the ones that have that. There's 3 that I know of that do. There's probably more now, because I think a lot of that data is out there now. So the manufacturers are trying to adapt. But there's Gero brand, which you can get at Whole Foods, but of course Whole Foods is like whole paycheck, and so it's like $55 or $60 for a bottle. At Costco, there's one called Cunol. It's a red and white bottle. Both the Gero and the Cunol are 100 milligram doses, so I recommend taking two a day of those. If people eat like sardines and stuff, sardines have more CoQ10 than anything. So I would encourage you to eat a lot of sardines a few times a week if you can, but not the boneless, skinless kind. Get the kind that's the whole fish, because that's where really all the CoQ10 is. There's another CoQ10 from Theralogics. What is it? NeoQ10 or something? NeoQ10, and it's 125 milligrams twice a day. So the Qunol and the Neo Q10, I think, are like when I've run the numbers, tend to be the most cost effective.
Yeah.
But there's very little penalties for manufacturers and selling fraudulent supplements. So I would not get that one, at just like at your Walmart or Walgreens or whatever, and even with like did we talk about that study where it was, I think it was out of Cornell, where they did the herbal supplements, they did DNA testing on herbal supplements.
Yes.
And it was like 3% of the Walmart samples actually had the real, the real thing. I mean, come on, that's shameful. I mean, that's horrifying. And, and then the best was like Target was like 30%. I mean, it's just, it's horrible. At least Costco tests all their stuff. And not that I have Costco stock, I don't, but at least they test all their stuff, and then they really punish those suppliers if they're fraudulent. But so you really need to watch what you're getting. If a pharmacist hands it to you from over the pharmacy counter, like it's a prescription prenatal, by definition, that's like been USP tested, right? It's like the United States Pharmacopoeia. It's like a legit deal. Same with the folic acid prescriptions that we fax in. Those for sure will be legit. Or like the ones in the store out on the shelves could potentially not be. So, but I haven't heard about fraudulent folic acid. But anyway, so prenatal, vitamin D3 2,000 a day, CoQ10 100 to 125 milligrams twice a day. What else are we telling people to take?
So going back to that vitamin D, it's always good to just take it, just because you never know when you're lacking of it. I took a blood test actually for vitamin D, and Dr. Hutchison said that it was like the lowest he's ever seen.
Yeah. Well,
so I started taking it, and it's giving me energy, and I'm not so lazy in the morning, so it's good.
I don't think she's ever lazy, but when a lot of this vitamin D stuff started coming out about 10 years ago, and it was mainly the medical endocrinologists that were kind of like raising the red flag and saying, hey, they really need to pay attention to this because it may increase cancer and diabetes risk. So I tested everybody for probably a year and a half, and nobody passed. Nobody passed. I mean,
yeah.
So, I'd have friends of mine who were dudes come in here, and I'd be like, let's check your vitamin D level. One of them passed. So, but he's a guy who's really super healthy, health food kind of conscious guy, has really super solid nutrition. So, yeah, so kind of a bigger deal on that. People, I was going to say, like, strategies for remembering your pills. Do you forget stuff?
Every day.
You're pretty good about it. Even good pill takers, like I've got to take medicine for my blood pressure, and like I will be at the end of the month when it's like ready for a refill, I'll be like one extra, and I'll be like, all right, I know that the machine counted that, so I have forgotten that. But with the prenatals and all these other things, if you have trouble remembering, tape them to your toothpaste or tape them to your mirror, like right where you put your face in the mirror. I think is a pretty helpful thing. Going back to the sugar a little bit, I think we've all been kind of lulled into thinking that, like these processed foods and sugars are okay. They advertise them on TV. Certainly if you grew up in my generation, kind of it was thought like if it was on TV, hey, the government, the government watches that. So it's got to be good. So like Pop-Tarts, and they're good for you, man. Orange juice, all that's good for you. And so I think we need to be we need to rethink it. Like I remember you got the free ice cream cone thing?
Oh.
Do you remember? This shortly after she started working here.
So my brother texted me, I think it was Dairy Queen was having like free ice cream. So Dr. Hutchison's like, so what are you doing tonight? I was like, nothing. And I'm like, okay, I'm going to go get a free ice cream at Dairy Queen.
Yeah.
Shouldn't have told him.
The way I remember it is you were leaving and you're like, I'm going to get a free ice cream at Dairy Queen. And I was like, whoa, there's a cost to that. It may be free, but it's pretty bad for you. Ice cream, by the way, in my career, there's a bacteria called Listeria monocytogenes. You guys probably heard about that, but it can cause miscarriages and stillbirths and bad things. And in my career now, I think we're up to 5 outbreaks that Centers for Disease Control have identified that have caused a bunch of miscarriages apiece, and all of them are from commercial ice cream. So, I mean, take it with a grain of salt, but if I were pregnant or trying to get pregnant, I would not eat ice cream. I can tell you that, unless I made it myself. And actually, that's pretty tasty. But go easy on that. If you have to make your own ice cream, it's kind of like, if you had to butcher your own chickens every day, would you eat them as many? I don't know. Yeah, so it's kind of like, but
put it that way.
Yeah, but really non-processed food, okay, is another thing I think that is really important, because I think that these processed foods are really killing our good gut bacteria, and it's really hard. There's no studies. Like, I've been trying to do a lot of reading about this, but it's really difficult to do studies that show okay, these people have this bad gut bacteria, but how do we make it better? And really, these probiotics that are sold, they really may not really be doing the thing that's right. And the only test that I'm aware of is, and you guys can look it up, it's the iGenomics, IGENOMIX. That did I say that right? Anyway, iGenomics, IGENOMIX. Yeah. So it's a Spanish group, and they collaborate with Stanford, and they have a test now that has not been approved in the United States, because apparently it's being hung up because they traditionally have said, this is the test results on your patient's uterine lining bacteria, and we're recommending this kind of antibiotic if they're not allergic, and FDA doesn't like that. So they're going to have to market that test without antibiotic recommendations. But until we have that, we have really no way to tell you what your uterine lining bacteria is. And there's really good data out there that if that bacteria in your uterine cavity is bad, it's hard to get pregnant. It's hard to stay pregnant. So I'm telling everybody to eat active culture sauerkraut or kimchi, a couple tablespoons a day, as it really may help with that, getting that uterine cavity ready for implantation, getting the bad bacteria out of there. Because those lactobacilli, they make acid as a product of their metabolism. So they kind of drive out the bad bacteria, which is really cool. They're kind of putting the hurt on those bad bacteria. And a lot of those bad bacteria tend to have been associated with worse mood and, like depression and all kinds of stuff, worse sleep. So, getting those good bacteria into your gut is really helpful. Also with chronic yeast infection, like when you were working at Avella, did you have people going and getting boric acid suppositories because the
Yes.
fungals wouldn't work? Yes. Yeah, so we're in an age where, man, there are getting to be some bad fungal organisms out there. There, you want to have the hair stand up on the back of your neck. Read about Candida auris, AURIS. It's a horrible superbug that was apparently from overuse of antifungals being sprayed on agricultural products in Asia. And now it is going to kill a whole bunch of people. And you do not want to feed it sugar, right? You do not want this thing to grow in your body. So keep your sugars and your starches down. Keep your good bacteria going in your body so you can make the environment for those fungal organisms as bad as it can be. We're not, you don't want your vagina to grow, wine or beer, I think that's the main thing. You don't need yeast in there in large numbers. What else? What else do you think of? Anything else we have for just recommendations for supplementation for people? I think that's about it for me. Anybody have any questions? So I see a lot of you are saying hi back. Thanks for logging in. Yeah, lots of fun. But yeah, so you can always ask us questions later. And then you can always look back at our other Facebook Live things that are archived on our page. I think some of them are going on YouTube now and stuff. It's kind of weird, but so look at those. For those of you who are interested in third-party reproduction, Heather Strickland, who is a very fine adoption attorney here in town, was here I think the last time we did one of these or time before. Aaron Sperry, Kevin Murphy, Alina Lackenpaul have Celia Valenzuela have all done those with us, and I think they're all really super informative. So, but if you have other questions about all this stuff, you can always send them in to us, and then we can answer it at a different one.
We have one next week.
Next week on thyroid disease and getting pregnant and being pregnant. So
yes,
tune in. Oh, and then I did want to address, I forgot that. So there's the thing about, well, maybe we did, about methylfolate versus folic acid. There's just not enough research. I mean, you'll read about this stuff that, oh no, you got to take methylfolate, or oh, you got to be tested for MTHFR. The methylene tetrahydrofolate reductase deficiency occurs in at least 40% of the population. And American College of OBGYN, the endocrinologist, the family medicine people are now saying, no, you should not be tested for that because it doesn't seem to make any difference. Even if you have the MTHFR deficiency, then you can just take the extra folic acid and it'll protect you. So anyway.
Yeah. So bottom line, nutrition is very important. Trying to get pregnant. I didn't even know you had to be very healthy to try to get pregnant. I was telling Dr. Hutchison, I was just told once you're pregnant, you have to start, your nutrition. But working here, I've seen so many things that I even changed my nutrition. So I cut my sugars, no ice cream. Okay, maybe once in a while.
I will eat ice cream in a while. It's pretty tasty.
But nutrition is very important. Working here has helped me a lot. I always talk to Dr. Hutchison about it, and I feel great. So
yeah, no, it is. It's important for your general health.
Yeah.
Very good. Thanks for tuning in, and we'll see you next week.
Bye.
Thanks.